Hey guys, welcome back. So let's quickly differentiate the types of AV block. So basically we are having three types of atrioventricular block. So that is the first degree AV block, second degree AV block and the third degree AV block. Okay, as you all of you must have heard about. So in the first degree AV block, guys, what we need to understand over here, look at this ECG. We can very clearly see that this is the P wave, this is the Q, this is the R and this is the S, right? So we need to take care about the PR interval, right? So we need to focus on the PR interval. So if you will see, this is the PR interval, so you need to keep tracking the PR interval. So if you will see very closely that the PR interval is actually prolonged over here, right? So we will be seeing prolonged PR interval in the first degree AV block. That's it, guys, right? Now if we talk about the second degree AV block, then we are having two further subclassification. One is the Mobis type 1 AV block and second one is the Mobis type 2 AV block. So Mobis type 1 AV block is also called as the Vanckeback phenomena. As you can see over here, I have wrote over here, that is the Vanckeback phenomena. Let's jump into the ECG over here. As you can see, guys, over here, this will be the P wave, this will be the R wave. Look at the PR interval over here, right? This is the PR interval, and look at this one, this is the PR interval, right? Look at this one, this is the PR interval, right? And like this is the P, and here there is a gap. So here there should have been the QRS complex, but here we are seeing that QRS complex is missed, right? So this P wave, it's not converting further into the QRS complex over here. So what we can see that PR interval is actually lengthening. So here PR interval was this much only, and here we can see that it is prolonging with each beat, right? So in the Mobis type 1 AV block, what we will be seeing over here is that PR interval keeps on prolonging, and at one point of time there will be a missed beat. Okay, at one point of time there will be a missed beat, right? And again, if you are having some kind of confusion, then how you can actually identify that yes, this is the Mobis type 1 second degree AV block? Just look over here, just look at the missed beat. Wherever there is a missed beat, okay, so the previous PR interval you need to compare. So this PR interval you need to compare with this PR interval. So this PR interval, after the missed beat, the PR interval will be very short, and before the missed beat, PR interval will be the longest, right? So this is the very good trick to differentiate that yes, this is the Mobis type 1 second degree AV block. This is also called as the Vanckeback phenomena. Okay, moving on to the next one, that is the second degree AV block type 2, that is the Mobis type 2. In the Mobis type 2, you can see over here, this is the P wave, this is the R wave. So P, this will be the Q, this will be the S. So you look at the PR interval over here, look at the PR interval over here, look at the PR interval over here, you will notice that probably this PR interval is same in all the beats, right? But what happened over here, this is the P wave, and yes, here is a missed beat, here is a missed beat, right? And then again what happened is that again there is a P, Q, R, S, and then this will be the T, right? So if you will compare the beat before the missed beat and this one, okay, so after the missed beat and before the missed beat, if you will compare over here, then we can see that PR interval over here, PR interval over here is same. So that is the most important differentiating point or differentiating feature of the ECG between the two Mobis 1 and Mobis 2. In the Mobis 1, we saw that before the missed beat and after the missed beat, if you will compare the two beats, PR interval, before the missed beat, PR interval was the longest over here, and after the missed beat, PR interval will be the shortest. But over here in the Mobis 2, the PR interval length will remain same. So that is a very important point, that PR interval will be same before and after missed beat, right? Before and after missed beat. This is kind of a trick which you can use in your MCQs and clinically as well. Now look at the next one. This is the third degree AV block. Third degree AV block is also called as the complete AV block, guys. This is also called as the complete AV block. In the complete AV block, what we can see over here, look at the waves, right? First of all, so this is the P wave, right? And here there is nothing. P wave has not been conducting over here. Again there is a P wave, right? This is also not conducting. This is the Q, this is the R, you can say this is the S, this is the T, haphazard kind of wave you can see over here. Again this P wave is not conducting. So P wave will be actually P wave is having the different morphology and QRS complex will be having the different one. So P wave is not synchronizing with the QRS complex, right? So P wave usually it is depicting what P wave is actually telling us about the atrial activity, right? So atrial systole, and QRS complex is telling us about the ventricular depolarization, right? So over here we can see that P wave is having the different pattern and QRS complex is having a different pattern. So there is no synchrony in between, synchronization is not there between the P wave and the QRS complex. So there is no relationship in the between the P wave and the QRS complex. So you can understand that no relationship between the P wave and QRS complex, right? So P wave and QRS complex, it means that no impulse is going from the atria into the ventricles, right? So atria is contracting at its own speed and ventricles are contracting at its own speed. That's why you can see that P wave again, P wave, right? P wave, and here is a QRS complex, right? So they are not following each other basically. So P wave and QRS complex, they will be having no relationship between each other. So that is called as the third degree AV block, complete AV block, very dangerous one, right? So I hope you got a brief idea about how to differentiate different kinds of AV blocks in a short period of time. Thank you.